Dear participants, welcome back to the final session of the 6-day Atal FDP. It gives me a great pleasure to introduce our esteemed speaker for this session, Dr. G.N. Vivekananda. Dr. G.N. Vivekananda sir is currently serving as an associate professor in the School of Computer Science and Engineering and Information Systems at prestigious Vellore Institute of Technology, Vellore. With over 12 years of experience, Sir has contributed significantly both in research and academics. Dr. Vivekananda Sir holds a PhD degree from Jawaharlal Nehru Technological University, Anantapur. His research interests span a wide spectrum encompassing networks, security, AI, ML, cloud computing, IoT, and blockchain technologies. Sir has published numerous peer-reviewed papers in esteemed journals and conferences, along with 4 patents to his name. Sir has made an impressive research contribution as a diligent reviewer for over 100 papers in SCI and Scopus journals. He is a senior member of IEEE and holds a life membership in prestigious professional bodies. For his remarkable and outstanding career, Sir has been awarded as a young researcher for the consecutive years 22 and 23, and also Sir has been awarded with the Best Faculty of the Year for the year 2024 by Computer Society of India. Dr. Vivekananda sir has also been recognized as a distinguished researcher in computer networks and been awarded by International World Research Council in 2020. His contributions to academia and research and industry emphasizes his firm dedication to advance the frontiers of computer science and engineering. Dear all, please join me in welcoming Dr. G. Vivekananda sir. Welcome, sir.
Yeah, thank you very much for your brief introduction, sir. Thanks a lot. I hope so I'm audible.
Yes, sir.
Yes, sir. Thank you. Give me a minute. I'm sharing my screen, please. Very good evening, all. Dear participants. Let the session be a little bit interactive. A very good evening, all. So thank you very much for the invitation for this beautiful Atal FDP program. I'm happy to be a part of this program based on artificial intelligence for healthcare. Sir, I'm audible. Can you please confirm?
Yes, sir. Yes, sir.
Yes, sir.
Clear, sir. Everything is clear.
Okay, thank you, sir. Thank you very
Right.
much. Yeah, as the sir introduced myself, Dr. G.N.Vivekananda. I'm working as an associate professor in the School of Computer Science, Engineering and Information Systems from the Department of IT, VIT, Vellore. And today, my topic is on recent scope and advancement in artificial intelligence for healthcare. Okay, this is my agenda for today's talk. I'll be starting with the introduction part. Thereas we'll be going into looking into types of AI which contributed for the healthcare systems, and what are the prominent organizations that are using AI for healthcare. We'll be looking into it. How the AI started its working in the healthcare sector, and what is the research in AI? What are the different aspects of research in AI? We'll be looking, and I'll be showing a little bit hands-on regarding one of the different AI applications I have published. Actually, we'll be looking into one such context, and we'll be looking into what are the different healthcare applications in AI. Finally, we'll be looking into what are the advantages and challenges of AI in healthcare, and what are the future scenarios for the world and for our country in the AI for healthcare. And we'll be concluding the session. These are the few contents of my agenda. Let us start with the introduction part. Yeah. Coming to the AI introduction, artificial intelligence is one of the hot topic that IT industry is hovering around these days. That is, AI is the simulation of human intelligence processes by machines, especially the computer systems. It is ability of a machine that think and learn like a human being. That is, AI is trying to relate the patterns that one branch of language and knowledge field aiming at the developing techniques and tools for solving different problems for the good. That is for the society mainly. And AI is a software think like intelligently in the similar manner the intelligent humans think because we are training it. Okay, AI is accomplished by studying how human brain thinks, how humans learn, how humans decide and work while trying to solve the problem. That is why we call it as a cognitive functions, how our mind functions. Similar way, the AI tries to function. The AI nowadays it can play a key role. It is playing a key role in many sectors like healthcare, agriculture, e-commerce, NASA, robotics, transportation. In many roles it's been introduced. And if you look into this part, the AI is a human intelligence research and prototype where a wise specialist is a system that knows its situation and conducts the activities that amplify its risk of development. You can see here in the picture, we started with a little AI with the error. Okay, then we tried to increase the accuracy to a vast extent from 40%, from 40%, 50%, 70%, 85% to present day 90 to 95%, we are getting accuracy in different fields of artificial intelligence by different tasks that we are performing. AI is not new, but the field has recently made rapid progress. For example, if you say to a limited, tremendous volume of current generalized computerized knowledge. And also, if you see, we understand that machines will not be replaced by human doctors within a responsible time period, but AI may help the doctors to decide on better clinical decisions. Okay, on even supplant human judgment in some certain utilitarian zones of medicinal services like radiology, neurology. Okay, I think you could have heard a recent chip transplantation that is done by the Elon Musk organization. Okay, it is also a form of AI. That is brain. They transplanted a brain in form of a chip from one person to other person. The raising accessibility of healthcare information and rapid improvement of big data analysis methods have made AI's ongoing productive applications in different medical services that are conceivable today. And also, if you see, incredible AI techniques led by critical investigations that will open up the clinically relevant data covered by the enormous amount of knowledge, which can thus assist the normal clinical leadership trials also. And why AI is to be introduced in the medical field? What is the necessity? Is there necessity to introduce AI to the medical field? And how come it becomes successful if we don't have knowledge in AI? As per a recent survey conducted by World Health Organization, give me a minute. Yeah, you can just look into this part. AI can be used to develop a more efficient healthcare ecosystem based on the results they have achieved, and patients will be able to better understand their symptoms and receive the treatment they require with the support of such better digital infrastructure. And there is a huge demand for the AI worldwide. You can see that demand here based on this lecture. The median age in Africa is 19. In Africa, some percent of people over the age 60 is 5%. In Europe, it's 21%. You can see why healthcare is very necessary. Let me say, for rural people, for urban people we are getting a little bit healthcare. When coming to rural areas, still healthcare is a bigger issue in terms of the rural areas. That is why healthcare is a basic demand, okay, in different ages, in different countries, in different areas too. If we try to get this AI even to the rural areas, we'll be successful, that such that we can create a diseaseless, or I can say we can't, although we may not be diseaseless or issueless or something, we can try to get the diseases down. We can try to lower the impact of the diseases. We can try to increase the use of the medicines for the ones who need it properly. Okay, and different AI types, if you see, we have seen AI. I think so many of the topics were covered in the previous topics, previous sessions. If That's why I'm not going in depth of the AI types of AI. Okay, but types of AI, weaker AI, that is narrow AI, typically focused on narrow tasks. Strong AI, AGI, we call it as AGI, artificial general intelligence, machine with the ability to apply intelligence to any problem rather than just one specific problem. Okay, at least like a small typical human may look into this strong AI. Nowadays we are working on super intelligence, that is AI that is far surpassed that of brightest, that due to the recursive self improvement, super intelligence is expected to be a rapid outcome of creating artificial general intelligence. Nowadays we are making use of Gen AI, prompt AI, different types of AI came into existence for the necessity of the mankind. And what is this timeline of AI in healthcare? I'm speaking about only in the context of healthcare. Okay, please observe. If you look into the context of AI in healthcare, from 1995 to today, earlier it was coined in 1955 by Mr. McCarthy, and they started using this discipline from the 1960s, and they called this as an expert system to identify the bacteria and recommending some antibiotics. Nowadays, the AI is recommending what are the proteins needed also, proteins, nutrients needed for you to keep healthy, to keep yourself healthy. Growth of microcomputers and different levels of network connectivity also encouraged the AI system in healthcare for accommodating the absence of perfect data and build the expertise of physicians. Next, genomic sequencing like databases, AI in electronic health record systems, NLP, robot assistant surgeries started from 2010, and from 2019 onwards, drug discovery, medicinal usage, discovery and implementation of different medicinal need, preclinical research. No need to test on on any animals nowadays. You can test on some sort of simulation, personalized healthcare, and many more were introduced from 2019 to date. There are n number of innovations in the medical and biological engineering in terms of AI. Let me show you those things also. You can see here with a clear context. From 1950s, they started having artificial kidney, X-rays. Okay, we used to call them as a expertise intelligence. Next, cardiac pacemaker. They used to arrange some sort of tune the heart beat and to have the heartbeat properly also. Cardiac bypass surgery, production technology, defibrillator. In 1960s, heart valve replacement, intraocular lens, ultrasound, vascular grafts, many such things. Like this, 1970s, computer-assisted tomography, which is still is being one of the top thing. Artificial knee replacements, endoscopy, balloon catheter, electrical engineering. 1980s, magnetic resonance imaging. That what I mean to say here is the use of AI or deep learning strategies or whatever AI it is, including artificial neural networks. That is another way to deal with AI. Using an ANN approach, computer commands create a artificial neural decision making system also that works in way comparable to the organic sensory system. Okay. In medical science healthcare, if you see, ML field clinical decision support the systems that had been proposed for pictures survey and translation for radiology, dermatology, pathology, and for improving the extension and precision of the different medical sign interpretations also. Okay, that is in the imaging, this is very highly used nowadays. And what are the different technologies used in the healthcare at present? I said machine learning, deep learning technologies, as well as nowadays Gen AI, machine vision, okay, computer vision, natural language processing, robotics, like for performing the robot surgeries. These are a few technologies that are included in the healthcare for the better healthcare system. And if you observe here, new generations of medical technology products, which combines the borders between the traditional categories of medicinal devices, pharmaceutical products, and human tissues, or the converging technologies at present that makes use of different types of information technology along with the biological sciences, material sciences, okay, nanotechnology, whatnot. Everything is included in this healthcare for performing the better, for giving the better healthcare for the society, for the people. And if you look into the AI in healthcare, you can just see here what are the various sections we have here. We are using AI in healthcare in hospitals, medical imaging, data analytics, doctor-facing mental records, genetic research, information and clinical trials, drug discovery, mental health, personalized genetics, wearable devices, AI chatbots, whatnot. In everything, we are making use of this AI in healthcare nowadays. And if you look into this topography here, you can see here AI, how it is being used in healthcare. Okay, and parts of AI like machine learning, the subsets of AI like machine learning and deep learning, how they are being used in the different sort of health sectors for research, for wearables like smartwatches, and also some devices that measures your minute to minute, and drug discovery, virtual assistants. What is a patient? Is there any chance of patient data? That is patient data and risk analysis, hospital management, mental health status of a person, surgeries required, lifestyle of a person, how it's going to monitor the digital health diagnostics, how it's going to perform the digital health, and how it is going to achieve all these things using this algorithms and techniques that we use in the machine learning and deep learning. If you look into the machine learning, I think so you could have heard from the few classes based on some sort of prediction, right? I think so you have seen prediction or detection or classification that are based on the supervised, unsupervised, and reinforcement algorithms. Or let me say deep learning. Deep learning comprises the network which are capable of learning from the unstructured data. These are the few things that we can see where for which we have to learn artificial intelligence, for why we have to apply artificial intelligence for healthcare applications. Okay, normally we'll be seeing artificial intelligence for the agriculture applications, AI applications in the education, AI applications in some other context, transportation, AI, insurance, many things we are seeing. Why don't we use properly AI for healthcare? Okay, that is what we are going to look into today's session. AI, what are the different organizations that are working for AI healthcare? You can see a few, like iCarbonix, Babylon Health, E2 Technology. Most of these are from Japan, US, Bigfoot Biomedical, Pager, Zebra, UMedi, and Enlitic Incorporation. These are the few organizations that are working for the AI in healthcare sector. As we have seen in the old movies, AI is no longer a fiction because it is completely transforming the healthcare in different sectors like training, research, treatment, decision making, diagnosis, early detection, medication, clinical search, many things. Okay, and let me introduce you guys for some healthcare data, because if you want to perform AI for AI, if you want to apply AI in healthcare, you have to first have some sort of problem definition. That is what is your problem hypothesis? Once you have formed the hypothesis, what is the problem? Data collection, how you are going to collect the data for the particular problem. Once you have collected the data, now how can you analyze the data? Analyze the data. Before a model development, we have to analyze the data. Once the analyzing of the data is completed, develop a model. Once you develop a model, communicate the product results with the stakeholders. Sometimes in between a few more extra things like prior distribution also may be involved, but these are the regular series of steps that we follow. Collect the data. Before collecting the data, define what is your problem statement, form a hypothesis, collect the data, analyze the data, generate a model for using your data, for simulating your data, and finally, after analyzing, you can communicate the results to the stakeholders. Okay, guys, these are a few steps that are involved normally. Now, introduction to healthcare data. You can see here, healthcare data should be trained. This training should be maximum. Training and testing are also one of the major part that we do in the MLDL, right? Training in AI normally, training by knowledge generated from clinical activities such as screening, commitment, treatment, treatment of the particular task. Before AI structures can be sent in healthcare applications to learn comparable objects, meetings, relationships between the subject highlights and premium outcomes. This clinical information often exists in the form of different formats of socioeconomics, restorative notes, electronical medical gadgets information, physical examination, clinical laboratories, and different sort of images, which are not yet limited actually. We trying to train much more because even 70%, 90% accuracy is not sufficient. We don't we are not ready to accept 10% of failures. We need most probably 100% of accuracy. That too in mainly the health system. If anything goes wrong, the complete system will be a failure. Okay. Now let us look into how AI can help in healthcare. Yeah. Better health results. Better health results. That is, it enables the doctors to diagnose properly and it can give the better results with a good accuracy. That's what I said. 90% of the result is also not sufficient. You need 100% result and assure medical drug safety. I think so. We could have known this in the period of COVID. Okay, many organizations fought to discover a drug that is that kills the bacteria, the infection, COVID infection in terms of COVID virus, right? That's why at times many organizations they have tried to empower the pharmaceutical like Bharat Pharma, pharmaceutical manufacturers to quickly access the consistency, look into the adequacy and promotion of the new product expectations and getting new treatments for faster recovery and market growth. Earlier, they used to perform these knee surgeries. It is a very tough task. Now they are performing it very simple with minor surgery, laser surgeries, clinical preliminaries of quickening the using sources of certifiable knowledge, control costs. Okay, earlier many treatments used to charge some lakhs of rupees. Now they came in thousands. Who knows? With the government intervention, they may come to your doorstep also with very affordable cost, right? Improve medicinal clinics. Many trials are going on still on different types of diseases like diabetes. Today or tomorrow, you may get a medicine for diabetes also. Okay, because as clinical trials are increasing, the fastness of the trials are also increasing. They will try to increase the accuracy also. Improve the medical clinics, clinical representation by improving the staffing assets and making a change to reduce the number of readmissions from the emergency clinics. Applications of AI in medicine mainly has two branches. We take it into two branches. One is a virtual branch, one is a physical branch. Because If a patient want to come to the hospital, the doctor will not tell, don't come again, right? Come after a week, right? Come after 2 weeks. Like this, they'll be looking into you iteratively. It is highly repetitive work. How can you avoid that? Nowadays, nowadays it is a little bit business also. Apart from business, empower the doctors, help them deliver faster and more accurate, give accurate services. Although we are taking the medication, still we are not getting any relief from the different sort of diseases. Whose problem it is? It's a doctor problem who is giving us the wrong medication, or it is your problem? You are not having any sort of immunity power for the particular medical thing. You don't know those things. Augment the professionals. Okay, if we have seen uh, for a year or two, I think so, we went physically to take the COVID test. Okay, and few organizations have developed that COVID self-care test also. We can also test ourselves. We can also test ourselves that we have COVID or not. I think so could have seen it. Many such devices are there. Replace personnel and staffing in medicinal facilities, particularly in administrative functions. Computerize all these things. You can manage the wait times on automatic scheduling. No need to make the people wait for hours and hours in longer queues. This gives some exact time to visit, exact time of visit. Deep learning devices that will not replace that will not, devices are there, but they will not replace the some clinicians, right? They will not replace clinicians. They will not replace as the nurses or doctors. They may assist them. That's all. Okay, devices, robots, they may assist the others, but it is not a full-fledged replacement for the existing ones. You see here, yeah, AI in medicine. I said we have two branches, right? One is a virtual branch and one is a physical branch. You can see here the virtual component that is represented by machine learning. We nowadays call it as a deep learning technique, which includes a few mathematical algorithms to improve the learning experience. Here also we come across three algorithms generally that we use in the ML, like unsupervised algorithms, find the pattern abilities, supervised algorithms for prediction and classification, reinforcement algorithms, use of sequences and rewards and punishments to form a strategy. Okay, let me say, if you have found wrong, you will be getting a punishment. If you have found right, you will be getting an award. I think you could have heard about this. In the breast cancer, the detection ratio is being very less nowadays because using AI, they started detecting these types of breast cancers in initial stages, and they try to resolve those things in the initial stages only. How it happened? Through the AI. And similarly, let us look into few physical branch, like what are the physical things that are needed on your body. I think so everybody could have seen the Iron Man movie, right? The Iron Man will be having some sort of device inside him because it is some sort of bullet shot, right? He will be maintaining the particular device inside himself, which is an AI equipment. That is an AI. Objects, medical devices, sophisticated robots for delivery of care, robots for the different surgeries. Okay, these are the need for the day. We need these things every day, right? Now, are there any plans to implement the AI in healthcare systems? Yes, definitely. You can just look into this. What are the plans to implement? Many AI interventions shown promising results that could soon be used for augmenting existing strategies for delivering different types of healthcare services in LMICs. Also, you can see this AI helps in disease diagnosis, where AI-powered interventions could be used in different countries with insufficient numbers of health providers, risk assessment, where tools based largely for machine learning. Okay, for supplementing the clinical knowledge. Earlier, what they used to do, they used to perform the clinical trials initially on the rats, on the monkeys, on the pigs. These are the main three things in which we have in common. They used to say these three things we have in common, like pigs, monkeys, and rats. They used to perform many such sort of tests, clinical tests they used to perform on animals. Nowadays, no need to do on animals also, because we have an individual simulation data to perform such things nowadays. And how AI is transferring the procurement in the healthcare, how the procurement is changing in the healthcare because of this AI. You can see the AI has made greater strides in recent years. You can see with the technology making its way to industries as diverse as manufacturing and procurement and supply chain management in the healthcare industry. With AI is set to transform the way companies and the materials they streamline the operations. Some experts predict that within 5 years, around some 300 billion market, $300 billion market is the annual savings for the healthcare industry alone using this AI. They are saving huge. No need to use it, right? Now, how clinical usage of especially here, different providers, healthcare providers are ensuring that AI applications like for gaining the adequate knowledge, skills regarding AI applications are crucial for medical students who may even have to use applications that didn't existing during their education. Earlier, they may not have read AI applications. Now, definitely, they have to learn those things to ensure the faster and the accurate results of their clinical trials. And what are the benefits of AI in medicine? Okay, as medicine is closely related to the healthcare, I have added this one also. How AI is helping the medicine. Integrating the medical AI into clinical workflows can give providers different valuable contexts. For example, a trained machine learning algorithm can help cut down the research time. Okay, within 1 year, we have got a medicine for COVID. How it was possible? Do you think it is possible without AI involvement? Once we have, I think so, I have attended a program in Cognizant from Hyderabad. They said how they used the AI technology for the development of the COVID vaccine. Even different industries like Cognizant from India are also a part of these clinical trials. Okay, they are doing many things for the healthcare industry using this AI. And don't you need to panic when you are involving this artificial intelligence in the healthcare? Yes, there is a chance, but the final answer is it helps for the error reduction. Okay, there is some evidence that AI can help improve patient safety definitely. Systematic review of 53 peer-reviewed studies examining impact of AI on patient safety found AI decision support tools can help improve error detection and drug management. How they are using drug daily. Let me say you have got you have got some you have some disease, and for a particular disease you have to take the medicine regularly, some twice a day or thrice a day. Although you forget, okay, if you have some device installed in your body, it will be reminding you, or there are some devices, okay, that only it will be injecting some sort of medicine in you for the particular time. Okay, that is what we say. Can help error detection and it can also help in the drug management. And how can it reduce the cost of care? We have said $300 billion of amount. How it is being generated? There's a lot of potential ways AI can reduce the cost across, like healthcare industry. It's one of the prominent industry where reducing medication errors, customized virtual health assistant, prevention, supporting mental health, clinical user happening. That is, we can reduce, we can cut off the cost. Dear participants, any doubts? Sorry. Yeah, please
It is
let me know.
audible, sir.
Yeah, no. If you have any doubts, please let me know in the chat. Okay, I have some chat I have seen. That's right. Right. Okay. Thank you. Yeah. Now, how it is increasing the doctor-patient engagement? You can see when coming to the context that are used in the AI, the algorithms that makes use of the it distinguish between the different types of information. If a clinical note includes a list of patients' current medication, okay, that AI can help us. It can also help to provide around the clock using different chatbots. These chatbots are introduced in every field nowadays. Nowadays it is included in E2E, business to business, E2E, e-commerce applications. Okay, let me say you are going for Apollo Pharmacy website or some pharmacy website. Even you have a chatbot card there that asks you what are you looking for, what medicines, what is your uh, present position. Based on that, they will suggest the medicines also. A few chatbots are there, but into the accuracy before using them. Okay, you can't use them blindly. I'm getting sleep. What it will tell, it will give some sleeping tablet name. Okay, use some 5 sleeping tablets, or if you use behalf of the count, will not be there tomorrow morning. Okay, you have to look into the accuracy of the chatbot also. How accurate? Because how trained it is. You can't take some medicines as you like. You have to take based on the druggist or the suggestions from the healthcare person, druggist. There is many patients think of questions outside the typical business hours, and AI could also potentially be used for triage questions and flag information if they need some further review, which would help alert providers to health changes that need additional attention. Okay, earlier used to take, from COVID it became high. If you get cold, take paracetamol. If you get headache, take paracetamol or Dolo. If you get cough, yeah, take paracetamol. Paracetamol is the earlier we used to have such things. Okay, some sort of uh, medicines, some sort of tablets. Every household would have kept that. Okay, for if in case of any cold and cough, metacin, anacin, some sort of such tablets we used to have in the household. Okay, because in such types, in such sort of any disease, it's an immediate cure. Okay, similarly, you could have seen, yeah. What is the contextual relevance here? The clinical note includes list of patients' current medication, along with the new medication. The provider recommends a well-trained AI algorithm that can use natural language processing for identifying which medication belongs for the patient medical history. No need to use everything. Just give me a minute, please. I'll have some water. Yeah, based on the medicinal, what you are taking, what medication you are taking, based on that also, your medication will be decided. I think so. You could have heard about this virtual assistants. Okay, in case if you can't go to a hospital, hospitals like big hospitals like CMC, they are providing you the virtual assistants also. Okay, just let me say you are booking an appointment, virtual appointment, that is a telephonic appointment. They'll be, let me say, based on your present suggestion, present conditions, they'll be providing some suggestions for you. what medication you can take for that, or you have to visit the hospital definitely and give the test. They're providing some suggestions. Okay, and how this improves the matters in medical education. That is what I have to look into. Yeah, understanding how today's medical student perceives AI, what they don't know, is a crucial first step, right? Because we don't know what they know, right? Some sort of computer science aspects like artificial intelligence, deep learning, cloud, big data also should be introduced to the medical. Because let me say, one patient is there, he'll be running to the hospital, the same test he'll be taking, and he'll be paying money in number of right. If I have a centralized database, big data, if they ensure they know, if they know a particular hospital, if I give his ID, some ID or name, something, it should be stored in that centralized database. Wherever he go, his information should be captured. All his medical history will be available in the hands of the duty doctor at that time. That is what they are saying here. Define one of the steps of curriculum development that needs assessments of targeted learners. A process by which curriculum developers also identify differences with what they need actually and what is the current situation of the medical field in India and what is the demand for AI growth. There may be many things. And why do you need AI in medicine? Okay, a study you can see here, a study has given, a study has done 117 medical students on 7 topics. Only one in the literature that investigated the importance of AI in the eyes of students. That is why we aim to examine medical students' perceptions regarding different possibilities of influence of AI in medicine. Also, their thoughts on AI topics to be integrated into the medical curriculum. Unfortunately, many of the medical practitioners are telling some baseless answers like as AI is replacing many software engineers, there is a chance that when we try to take AI inside this, it may replace us also. That is, it may replace doctors also. Okay, that is their fear. Because nowadays, I think so, you know, what are the hospitals and what are, it's a great business things. I think so there is a person, great personality like, I think so could have heard of him. He has done a huge research on this AI in healthcare, PV Rao, I think so, PV Rao. Another person, you can just browse him, PV Rao, healthcare and AI. He spoke very good things based on AI and healthcare. How AI will help in healthcare. What is the need of AI? Such personalities should advise the governments, okay, to take the AI into the governance and these medicinal fields. And what is the role of AI in public health? We can just look into this. It helps in disease surveillance, epidemic prediction. Like I think you could have heard, COVID second time. Okay, COVID's first strike was okay. COVID second strike was very dangerous. Many died. The COVID second strike when compared to the COVID first strike. And role of AI, what is the in terms of water treatment? Let us look into a few such things. What is the role of AI in disease surveillance? Survey, right? What the survey includes? The survey will be a combination of different case reports, queries, forums. It performs different senses analytics. Again, sentiment analysis will be performed. Climate factors. They compare the working models with the existing results from the different provinces. That the data model showed stronger statistical significance, by which they can tell they're performing a good sort of surveillance over the disease. And how can you screen the disease? There are a few steps in screening also. Without any, you should not tell. it is working or it is not working. As a service system is automated operates in a real time. Critical point of view, as soon as it operates real time, it is from the various assets. It needs to be alerted as soon as possible. It is identified. Such the spread of contagious infectious diseases such as influenza, anthrax, COVID. And what is our acceptance ratio of AI to the world? Are we accepting AI in the medicinal field, in the healthcare? What is our acceptance ratio? Directly, we can't accept it until and unless we tell some answers, right? What are the answers we need to tell? The strategies that we have applying. Okay, you have to collect some acceptance ratio, how much it is accepted. Investments that we can do in AI. What are the future researches that is possible in AI? Acceptance, if you see, different types of acceptances again from the consumers in a worldwide for a AI-enabled healthcare. You can see 50% are willing to have AI in healthcare. 38% still are unwilling. The ratio is too huge. That is why the healthcare is not yet completely mapped with the AI tools. Neither willing nor unwilling, 10% at most. If it is accepted, are our governments ready to invest in AI? Yes, they are ready to invest in AI. Investments, what sort of investments? Even private investments you can take from many organizations. You can see, containing the research firm that is involved in the AI and medicine, it is valued, medicinal valued at $719 million in 2017 only, expected to reach 18,119 by next year, that is 2025. One analysis has found a application could result in approximation of 150 billion in saved healthcare costs annually. There is no doubt. I think so. Elon Musk, the next, he is successful in the SpaceX. Okay, he is successful in getting the president candidate that he want. Okay, the next target of him will be taking the AI healthcare into the next level. Definitely, it will be happening. What are the different researches that is happening in AI? Yes, in a summary, you can see. According to Times, in between 2017 15, China published 41K papers on AI. USA published 25,000 papers. Japan published around some 11K papers. Yeah, with a good impact factor. Even we Indians also published around some 5K papers in AI in that mean period, with good impact factors. I mean to say, with good impact factors. Okay, and you can see by this how different countries like Japan, China, USA are forward looking. AI in healthcare. Okay, let us look into few more aspects like AI for universal health coverages in SDGs. The major goal was to provide good health. The whole major goal or UNESCO major goal is to provide a good health first of all for every citizen. The study shows trained teachers are in short supply in many countries. That is why if you have good knowledge and AI, you have big red carpet welcoming you for many countries in Africa which lacks basic education on AI. And similarly, if you can see the healthcare policy, developing countries like us are short of medical workers because we don't believe technology. We believe in money. That's why Google Pay phone are becoming such a hit. But we don't feel we are not looking into those aspects of the technology in the main fields like healthcare. Their applications are potential to fill today's main principle in seeing AI can be applied in all sectors of industries. There is it can be applied to the healthcare field also. If you have seen, based on in AI, a few years ago, some 106, you can just see here, yeah, 106 startups that are performing really very well in healthcare AI. You can just enlarge the screen and you can see if needed. There's 106 startups. Now the count is more than 300. This is a few years before data. Now the count is more than 300. More than 300 startups are performing extremely well in supplying the accessories, in supplying the softwares, in supplying the tools in supplying the automation, web applications, in supplying the prediction, classification, optimization tools for different hospitals. Different healthcare applications. If we start to develop early detection behavior by using clinical and diagnosis data that depicts the human behavior and emotions regularly. Self-leveling using historical data or self-judgment that is based on the previous actions and results. Okay, these are the things that are needed as a part of the day. Now, let us look into a hands-on topic. Before going to the hands-on, I just want to tell you what are the objectives of this hands-on. We basically understand different medical imaging concepts and applications. We try to apply and evaluate the model performance and interpret results. Okay, I hope so you are aware of this basic terminology in the medical, like medical imaging, X-ray imaging. I think so you are aware of this, right? Magnetic resonance imaging, computed tomography, ultrasound, positron emission tomography, nuclear medicine. Okay, if you see in medical imaging in 2024, it is significantly enhanced by the different AI and machine learning, which automate image analysis and improve the algorithms which help in detecting patterns. Normally the patterns, what are the patterns required? Based on the patterns, changing patterns also, it is easily identifiable. Like, and if you see additionally Python based tools like TensorFlow, PyTorch, these are commonly used to develop and implement machine learning models for better image processing and diagnosis. In 2024 and 25, the AI and machine learning continue to reshape the landscape of medical imaging. One of the most significant advancements that has been is automatic image analysis that can help you to perform the diagnostic accuracies, automate the image analysis. It can optimize the workflows. Okay, this expansion of AI technology is projected to transform the medical imaging market with estimates indicating to grow nearly some 760 plus million in 2022 and 14 billion by 2032. Okay, let us look into some hands-on part. Give me a minute. Sir, is it visible? Is the screen visible, sir?
No, sir, slide is not visible.
Not visible. Okay, give me a minute. So let me turn off the video for a few minutes. There is some bandwidth issue for a few minutes. Okay, it is not getting shared
Okay, sir.
for a few minutes. And again, if it connects back, I will connect. I have connected to the mobile data. Yeah, I hope so. Yeah, is my screen visible, sir? Not yet. I don't know what is the problem.
Yes, sir. Yes, sir. It is visible.
Oh, it is visible. Okay, okay.
Yes,
Thank you, sir. Thank you. Thank you, sir. Yeah, thank you, sir. Yeah, if you see here, I'm showing you an example of medical imaging. Right, so I hope so you can see, right? Yeah, you can see here what I'm performing. This is one of the hands-on session that we are looking into. Okay, I just have prepared few hands-on things for you guys. A few things like medical image analysis, brain tumor classification, and I will show different types of things that are performed here. Classification, okay, different things like chest X-ray classification, Parkinson detection, prediction, classification. Okay, all I have framed here in my notebook. In my notebook, all I have framed to show you as an example. I think so. You can see here initially we know many packages we are using in Python programming. We try to use the OpenCV package for the image processing. We try to make use of OpenCV package for the image processing. Okay. From Matplotlib, we have imported PyPlot as plot. That is, import the PyPlot module from the Matplotlib for plotting the diagrams. If you want to plot any sort of charts or plots or figures, okay, we make use of this PyPlot from the Matplotlib and read the image file. I have already downloaded one image file and I have kept here. There is the image file. Okay, this image file. The example that I am showing is now regarding the medical imaging. How the medical imaging is done. Okay, because at times many are doing the projects regarding the COVID nowadays. When they are doing the projects regarding COVID, they are seeing how much of phlegm is there present in the lungs, how clarity. Okay, if you don't have any clarity in the images, that is the main thing we have to do in the imaging, right? Clarity. If you have lack of clarity, if you have lack of clarity, the accuracy will be low. That is why you need a good clarity of image, good clarity of understanding also. Read the image from the file, and I'm displaying the original file. You can see here whatever I have downloaded. You can see what type of what image it is. What image it is, guys? It is a lungs, right? It's the lungs. We're looking into the lungs. Now, so here display the original. We have displayed the original image using the Matplotlib, and now we are trying to convert the image from the normal BGR to the RGB color space. We are trying to convert. We are trying to convert inside actually. See here, we are trying to convert into the black and white. If any parts are black and white, we are trying to convert to the color space. Turn off the axis here, turning off the axis, and we are presenting it. Resize the image. Resize the image. So the normal things performed. Okay, resize the image. Once you resize the image, convert the image to the grayscale. Convert the image to the grayscale. You can see CV to color. Once you have performed, display the grayscale image. If all the images in grayscale, you have to convert that image also that you are taking into the grayscale. If all images are in some color format, you have to convert the particular image also in the color format. Okay, this is the principle. I have got all the images in that particular grayscale. That is why I am converting it to grayscale itself. You can see, apply the Gaussian blur here. Applying the Gaussian blur. Convert the image from black and white to RGB color space. Again, get the dimensions. What is the height and width of the image? Get those dimensions of the image. get the dimensions of the image. You can see I'm getting the height and width of the image, width, height, and I'm calculating the center of the image. I'm calculating the center of the image because if we create a rotation matrix, okay, it needs some time to rotate the image by some 45 degrees for all the clear analysis. In every angle you have to see, is there content, anything content present? And if we are creating a matrix, you can see here, we are creating a matrix, rotational matrix, and you are displaying the rotated image here. And also again, after rotating the image, again you are converting the image from black to the RGB scale, and you are creating a sharpening kernel here, kernel. Using this, you can try to give the better accuracy for your taken data, display the sharpened image, and again convert. This conversion is a regular task. Okay, again convert the data and import certain libraries that are needed for you for performing the TensorFlow analysis. Like you can see here, import some important packages, OpenCV package, TensorFlow package, NumPy package, Matplotlib package, and you can read the same X-ray, whatever you have taken as consideration, display the image in graphical scale and show it. Okay, resize the image in different pixel size again, based on what image pixel you need. What is the important necessary layers from the Keras? You try to import those layers, and you can define a simple CNN model for your data prediction. Now you can see here I have defined a small CNN model for data prediction with 16 filters. You can see kernel size of 3, input shape of 28, 21, 1, height, weight, and how many parameters I am choosing here. 180 parameters I am trying to check here. Print the shape of the extracted features. Print the shape of the extracted features. Now try to display each feature map. See here, feature maps, you can see here how the data is being displayed. Important necessary layers from the Keras also you are trying to take it for the consideration. You are taking all the necessary layers, and you can see the image in different forms. What's in the blurred form, on applying different types of filters. Okay, and applying different types of some 16 filters we have applied. Okay, see here for 16 filters we have got the data in the different formats. Also now ensure that you are using TensorFlow for necessary layers from the Keras. Define the input layer clearly. Add a convolution layer. Reshape the output. You can see reshaping the output of the convolution layer. After adding the attention layer, flatten the output. You can see flattening layer. Flatten the output. Add a dense output layer with soft max activity, softmax activation. Guys, ReLU softmax, I think so you know about this activation functions. I'm not going in depth because this is the last session, and I hope so you have already went through many of these things. And you have to take an output layer to look into for predicting a model, and you are finally defining a model summary. How many layers you have taken in the CNN? Okay, 2D CNN. What are the things you are looking into here? And you can see here total parameters, count how much you have calculated. After performing the model, sequential model analysis on different blocks, you can see using the ReLU functionality, ReLU function. Okay, I'm performing the flattening again here. And you can see again, I have inputted the model and I'm displaying the model summary finally. See here, different types of different algorithms. What is the parameters and what are the values they have taken? You can see here different types of parameters and the values you can observe here clearly. Right. And finally, I'm printing the model summary for the existing data. Similarly, you can see here, there is one more data set directly I'm taking from the Kaggle for brain tumor detection. I started training the data. See here, the base data is from Kaggle only. That is why I have implemented this in Kaggle only. Okay, now you can see here how I started giving the paths, everything are from Kaggle. I have performed the category analysis. See here, it involves a few series of steps like initialize the list, look through each image, every image you have to look into, create a data frame for the image. Just you are not taking all the values, you are taking a few values from the head, a few values from the tail, that is below values. You are shaping and you are knowing the size of all the data. Again, see here, count plot, I'm performing the labeling for the different data set. I'm performing the labeling of the different data set, X label, calling it as tumor type, Y label, here, count type. Okay, you can see the count plot of the different types of data that we are used here for setting up. First of all, we are setting up a model. We are counting the plot and we are annotating the bars, displaying the plot. And I am showing the model in pie chart with different series again. I'm ensuring that you can see different types of charts. These are the different libraries I have used in the Kaggle. Okay, see here, if you see here, we can ensure we can apply the same. Okay, only few things will change actually here. We can apply to different applications. I have done, for example, to show you, but sorry guys, as we have a limited time. Okay, it's just 20 minutes we have more. I think so I'm unable to show these things for you in clear. Okay, these are the different healthcare applications where you can make use of AI very better. Excellently, you can apply for different types of, you can detect bone fracture, Parkinson disease. Even I have performed on Alzheimer's, I have done on a diabetic. Many applications I have shown. Okay, many applications are there by which you can apply the AI. The AI can be applied. Yes, yes, sir. Uh, Again, coming back. Um, to the top. The top. Yes, sir. Again, you can see the different applications that we make use in the AI. We make use of we make use of AI normally in the clinical care. That is use of AI to examine the clinical information, research publications, expert rules that could be informed based on the treatment choices as follows: disease identification and diagnosis. Just now we have seen one of the personalized treatment, behavioral modification, drug discovery, robot surgery, clinical trial search, doing repetitive jobs, treatment design, many things. Medical imaging, these also one of the application. If I get to have one more session, I could have said all these things. I could have shown all these things in detail, because showing one hands-on, it takes nearly some 1 hour time in detail. Okay, now you can see different types of applications, like also medical imaging that I have shown you a while back. Outputs have been collected and put away methodically for quite a while and are readily available for the preparation of AI system. Just if they give input, it will display the output. The cost and time associated with examining could be reduced by AI, conceivably allowing more likely target treatments in identifying conditions like pneumonia, skin and breast cancers, and many eye elements. And AI has shown promising results in many of the applications like cardiography, echocardiography, that is tested with the real-time research. And AI to investigate echocardiography also filters also that identify pulse, that can analyze the coronary diseases. Let us look into these applications in detail now. Disease identification. What algorithms are used for disease that are based on the symptoms to be answering chatbots? Like AI systems are being created to analyze different samples to predict definitely many insane scenes and detect track side effects of neurological disorders. Like I have created one example based on the disease identification, like Parkinson's disease. I have created based on this only. Parkinson's predict the Parkinson's disease infection. That is, it will identify the disease infection categories also. Surgery, whether the surgery is recommendable. Very constrained automated tools have been used in research for performing different types of complete complex tasks in keyhole surgeries, such as tying knots to close injuries internally. Image-based diagnosis. That is what I have shown you a while back as a sample. Okay, as of now, the best field of medical AI application is potentially computerized restorative picture analysis. This is one of the demanding research area. You can just try in that computerized restorative picture analysis, because numerous restorative forces depend on picture-based determinations, including radiology, dermatology, pathology. Similarly, we have a few more applications like personalized treatments that are more treatment-based individual healthcare. Okay, based on R&D and treatment efficacy, it can try to involve a major role. It will perform in some sort of diagnosis of various forms of like skin injury, like skin melanoma, skin image analysis, skin care treatment personalization. Many companies are there to build a suggesting engine to customize the skincare treatment recommendation for the personalized treatment of an individual. Also, many organizations are there nowadays. Similarly, drug discovery. Yeah, there is one of the important concept, right? Machine learning that we used already as deep learning speaks to the virtual component that is addressed through numerical calculations that enhance the learning through experience mainly. Okay, many top pharmaceutical companies are also making using these arrangements for what is a past model, what is a dependent grouping and forecast algorithm by which it can discover capacity to the new designs. Like you can see, AbbVie is using artificial intelligence in drug discovery, various pattern calculations. IBM's own health application has had initiatives in drug discovery in early days. Similarly, a few more robotic surgery, like we are afraid that robots make mistakes, but many of the hospitals in Hyderabad also nowadays are performing robotic surgeries for the knee treatment and all, which comes normally with 4 arms, which are freely moving and regular. It will take all the devices at once with high definition display for showing surgeons also what is inside, with X-ray during procedures, immediate X-rays. We'll put entire robots here in this part, okay, for free robotic surgery. But we have to give, there are few challenges also. It should have patient information. It explains the historic context of the considerations of patient's problems and may provide a medical regard with a psychological synopsis. Let me say, I am afraid of everything. I'm afraid of surgery. Then there is a chance that the patient dies on the spot when he is being taken to the surgery itself. That is why that robot also, it should not, okay, robot is fine, but it should know the knowledge. It should have the information of the patient, record of a patient, and use of robots to deliver. You can see, have seen already this regarding robot surgeries for monitoring the effectiveness of the treatments. AI, radiology, where you are using like characterization, how we are performing the characterization, how we are monitoring the data regularly. This is a very interesting topic nowadays, because sometimes what happens in area in terms of neural occupancy, neural theories, the cerebral tumors cause a significant redesign of the functional system. It will be keep on changing. The neurons keep on changing. Useful enrollment has been helped by simulated intelligence for giving the greater optimum percentage for the better enlistment. That is why brain tumor removal has been accepted as a perfect robotic surgery nowadays, because it is performing better than the human surgeons. It is identifying accurately how the neural movement is happening. Okay, and surgery knots, there are these few knots that are tied in the inside our brains. Such surgical knots tying is also a test for this AI nowadays. Similarly, AI in pathology, it is used many ways. AI in cancer, we can see one of the prominent fields, cancer imaging takes incredible parts in subjective translation by malignant growth imaging, including different outline of the tumors after some time. Extrapolation, it performs extrapolation of the tumor genotype and natural course from its radiographic phenotype. Okay, and clinical outcome prediction, assessment of the impact of infection, many things, interpretation to a worldwide that it has to be conceived. These are the few things that you can look into this AI application in cancer imaging. Similarly, a few more AI in cardiology in terms of heart arrest. Okay, how it is performing. It is looking into different actings like get into the AI-aided diagnosis, therapy selection, optimized resource allocation, continuous allocation of data, and similarly, clinical trials research, like it helps in shaping different clinical trials for access of the increased safety. Some applications in drug development. AI also synthesis drug-like compounds. It can create drug-like compounds. Drug repurposing. There is one thing in medical field like drug repurposing. That is AI in selection of a population for clinical trials. It will be selecting the data based on the person's age, the health factors, environment he has grown, the immunity power he has. Based on this, it will be taking a population for the clinical trials. Yeah, in finding the hit or lead in different fields, doing repetitive jobs continuously, x-rays, scans, cardiology, radiology. Okay, in future you can see it should only look at the most complicated cases where human supervision is useful. Okay, remaining everything should be performed by the robots. Treatment designs, like it have been created to analyze data. It will create a complete report. Okay, every report, what is a problem, where you have got the problem, how it can be resolved, what is the chances you have to take, present the patient to the doctors based on the disease availability of the doctor. It can maintain all the records of patients under conditions. Okay, similar to these, a few advanced approaches are also said here. You can please look into chronic health expected to benefit from most of the AML. I can see for which clinical areas it is promising. Diabetics, it is showing some 66 promising percent. Heart attacks, heart diseases, 63% is promising. Cancer, 63% it is promising. Unfortunately, none are more than 90%. That is why the people are not yet believing this AI to enter into the medical field completely. Okay, still much training is needed. Many more optimizers, outliers, functions, activation functions are to be taken into context to make the results much more better. Unfortunately, where the problem is, let me tell you the main challenge. Nowadays, the main problem is getting the data. You are getting the data, but the data may be irrelevant sometimes. Okay, when you're performing the PhD or you're doing a PhD also, they don't consider the data that you are using dummy data from the Kaggle or something. Take some ICMR data, request the data. You have to request, you have to send some surveys and get the data. Well, I think so we have a studied research methodology, right? We have to perform some surveys to get the data, or you have to request some sort of reputed organizations like ICMR, AIMS, on top organizations to get the data. You have to give a consent letter stating that this data will be used only for the research purpose. It will not be leaked or kept anywhere. Once you send any such consent, they may give you the data. Similarly, we have artificial intelligence that improves the quality of sleep. Different types of ML. See here, that helps as a chatbot for improving the healthcare of an individual. Okay, that improves the quality of your sleep. Even there are few chatbots that tells you the stories that makes you sleep. Okay, medicinal image analysis with the different types of images, videos. If you come into the medicinal context in the AI, text data is not sufficient. Text data is not sufficient. You have to ensure that we have to get some sort of heterogeneous data. That is why these are few similar advanced approaches in medicine, in healthcare bots we are using. We are using this, and we can see few advantages of the AI in healthcare. It is making the healthcare more accessible, but still there are many countries that are poor to accommodate for this. And healthcare remains most unpleasant for many of the countries still. And what are the different advantages? Still many more. We have got like people living in areas of remote areas. Yeah, they are also dying. They are not getting the proper medical assistance. I think so nowadays you could have seen drones are used in states like Andhra Pradesh to give a medication and to provide medicinal facilities even for the very rural areas. Drone, that is, I think so AIMS recently have started that, and few more advantages you can see here using the healthcare in AI. Like we have the ability to quickly, accurately identify the disease, and we can advance the healthcare treatment. Patients can ask different questions in absence of a doctor, reduce the treatment costs, makes treatment fast, decision faster, helps to reduce human errors. Like, let me say, you have got an error whether to perform the surgery or not for a particular accident. You may be in confusion, but if you upload the inputs to AI machine, it will take the decision. These are the pros, these are the cons. That is why you should perform the surgery. If you perform the surgery, nothing will happen, he will be survived. And it will be taking a decision whether you have to remove a leg or he will die. Immediately, yes, the AI will take the decision, remove a leg, amputate his leg, else the complete poison will be ended up in his body and he will die soon. To take such decisions also, AI is accurate nowadays. Different benefits we can see. Just now we have seen few such benefits: diagnosis, prediction, feedback, reinforcement, reduce diagnostic therapy, many errors, 24/7 support, experience in the different fresh clinicians, AI power techniques that aid in the detection of early risk, growth drivers for different AI care. Okay, that is for increasing the individual healthcare experiences. Also, we can see a few challenges here. Although we are speaking AI is for good, AI is for good, we are unable to accept AI for good completely because we have some challenges like adoption, regulations, security. See here, AI cannot solve all the issues in health also, right? We need to emphasize that practicing medicine is not a linear process. These are the few slides that I have taken from Mr. P.V. Rao, a practicing doctor, and he worked. He is working in AI in healthcare. Very good things he said about AI in healthcare. Actually, these are a few of them. And implementation of AI, a true challenge, because the question we have here is always have to face is how we translate the vast AI into everyday life. After the very first step, getting to know most possibly AI in healthcare, we should get a clearer picture of the obstacles that we have used in it. Similarly, how can we control this artificial intelligence? Means definitely we have to get some regulations. Then only we can get to control it regularly. We can customize it as per our needs. If you get some regulations, what is the future decision making with AI? That is definitely we are not going to stop it. AI will come into the medicine field, healthcare field for sure, and makers can't allow themselves not to tackle the issue. And what are the ethics involved with this AI? Like having the patient's information encrypted, okay, having the patient's data safe, embrace the different advancements of technologies by which we should have some bioethics also in the artificial intelligence, we can say. Anyway, if all of the things are also followed, artificial intelligence cannot replace empathy. This is the main thing, right? It cannot give the empathy. It doesn't have any compassion to show. Okay, it just follows the orders, that's all. Based on the order, it will be performing it. Who are there by your side for empathizing you? Okay, who is telling nothing will happen? Be safe. Your surgery is going to be safe. Who will tell that? AI will not tell that, right? It's a feeling of compassion and responding in a manner that other person knows they were understood. It's not there. And complex digital technologies, how they are requiring competent professionals, you can see. Many things, the vision of medical futures is you have to make use of the AI technology that will help bring medical professionals towards more efficient, less prone, and more seamless healthcare. This is the main objective. And by this, we can emerge utilities in different artificial intelligence also. And I think so. These are the different reasons why we need the artificial intelligence. Although AI systems are expensive, often tricky to implement, this cut down on different redemptions. They can eventually result in cost savings down by the line. And the main challenges involved here are integration issues, costs, whether we can bear the costs, integration issues, whether you can understand the particular technology when the particular technology is integrated in a particular organization to treat the patient, whether you are ready to give the inputs properly. If you don't give the input properly, again there will be a problem. Data privacy and security, right? And data exchange. That is why nowadays when we are taking the inputs also in some voice messages, voice calls, voice chatbots are also there. Okay, it will give us choice. We have to spell something, and based on our spelling, based on our dialect, it will tell what we have spelled. Also, it will repeat again. If you have spelled this, press 1. If you have spelled this, press 2. Because our language and our dialects also will change from country to country, from place to place. Okay, there is one more potential challenge. And yeah, we have to provide the real-time data. Minute to minute, you have to provide the real-time data. That is the main challenge. And improve preventive measures we have to ensure. Cost-saving plans and patient waiting times. These to be improved. What are the main challenges that are there with artificial intelligence? Automates per jobless, deep fakes are increasing, and these are the few future for medical artificial intelligence. Although AI is imaginable potential, within years, next couple of years, definitely it is going to enter into everyone's health life. For sure, you will be using at least in next 5 years, you will be using at least one of the AI device with healthcare on your body. That is for sure. Nowadays only we are wearing smartwatches, right? How many steps we are doing? We are calculating. how many calories you have done. You are calculating everything. Okay, I think so. 50% of the participants have fought smartwatches here. Then already you 50% are equipped with the AI healthcare devices on your body only. Okay. A future Indian scenario. This is based on the Indian context. I have written this. Collaboration with the academia, technical institutions, and deep tech. Deep tech. Okay. Ensure that you are looking into such aspects for entering into the healthcare using AI in healthcare. Look into the current status of medical records, electronic records, get the funding, get the good funding. If we are using good applications that is based on the healthcare. And by this conclusion, I want to stop my session. The healthcare sector, if you see, one of them that AI is going to play a main role to improve the treatment process more independently and with better results in terms of disease diagnosis and medical care assistance. I hope so you do agree with me. We know every advancement have both pros and cons. AI could mean a lot of power. Also, accountability should be there. And also the future of healthcare is completely on AI. I can assure that the future of healthcare is completely on AI. If the doctor fails also, sometimes the AI can solve a particular problem. By this, I conclude the session. These are a few references that I have used. Nearly some 25 plus references I have followed. These are the few. Yeah. Thank you, guys. Sir, do I have some 2 minutes to speak? Hello. I know it's already time. Do I get some 2 minutes to speak, sir?
Sir, just 1 minute.
1 minute. Okay. Thank you, sir. Health. Let me summarize all the key points from whatever we have discussed here. The key impact of AI areas in different things like diagnostics and early detection we have seen. Operational efficiency is needed. Personalized medicine is a need for the day. Drug discovery and development is a definite need. Similarly, remote monitoring of the telemedicine is also one of the major topic nowadays. Surgical assistance by which every individual can be benefited. Mental and occupational health. Everyone need these things, right? These are the few things that we have seen. And challenges keeps on existing, but regulatory hurdles and integration with the existing systems can help you to integrate the AI into your regular life. Thank you, dear participants. If you have any queries, please let me know. Thank you.
The participants can post their queries in the chat box.
Sorry for the extra time.
No problem. No problems.
Thank you, sir. Actually, it's a vast topic. I used to say take some 3-hour session based on this due to the time limitation only. Okay.
It was informative. Right. Participants
Thank
request you to post questions, if any, in the chat box, please.
Any queries, please? If you don't have any queries, I have the session, the code for classification and segmentation of a disease use case. You need code for classification and segmentation, ma'am? Okay, I will share with the sir. Okay, ma'am. I will share with the sir, right? You can practice. I will share with the sir. I will share the code with
take this opportunity, sir, and thank you for sharing your experience. Sure. We are truly grateful to you, sir, for contributing significantly to this FDP through your valuable insights and engaging presentation. Thank you so much, sir.
Thank you, sir. Thank you very much. I hope so I can leave the session, sir, if they don't have any other queries.
Yes, sir. Yes, sir.